The other thing I did want to point on as well, back to talking about, endometriosis specialists being they're not their own subspecialty, but not being the same as a gynecologist. In Ontario, we're very privileged that we have over half of the endometriosis specialists in Canada reside in Ontario. So currently in the entire Maritimes, there's no one. There's no one in the Maritimes. So in order to receive, expert care and proper excision surgery of endometriosis, you have to get yourself referred out of province, which then you're looking at costs and flights,
that's not easy,
and all of that. So yeah, that was another thing that I just wanted to bring to light, that we have about 45 of them in Canada and about 22 to 24 reside in Ontario.
That's insane. And then, the pandemic on top of that, with all of the closed travel, the more difficult travel, living outside of province and having to figure that all out, would be just devastating.
Absolutely.
Aye.
So it's heartbreaking. So hopefully one day some endo specialists will move to the Maritimes, because they really need it over there.
But again, that's those government incentives. Like, here's a little extra paycheck, and we're buying you a really pretty house by the ocean.
I'll take it.
Go change some lives.
Absolutely. Right.
And now you're the hero of the Maritimes.
Yes, 100%. Right. Instead of having to be referred, and a lot of them, go to Ottawa up by you, is where they get sent to. But yeah, we have the most. I believe BC and Quebec have the second. Manitoba only has 2. Saskatchewan, I think, is 1 or 2. Oh, maybe 3. I think Saskatchewan's 3. And then Alberta has about 6. So yeah, like we are blessed here in Ontario that majority of them are here. But then it also breaks my heart for the patients that don't have the access to that.
Yeah. But it's especially when you look at our healthcare system, and so often you'll hear people saying like how lucky you are because you have a free healthcare system. Also, we're taxed out the butt for this healthcare system.
I also did a post on that too.
It is so frustrating to me when somebody
went down to the nitty-gritty and I figured out the numbers.
You should appreciate your healthcare because it's free. And I'm like, nothing's free.
Nothing's free.
Ever.
No.
And then when you have something that's not as widespread or isn't affecting an entire population, like you just see how broken the system truly is.
Yeah. And the crazy part, to put it into perspective for some people who need it, like in the layman's terms, the same amount of people who suffer diabetes and who suffer asthma also suffer endometriosis. So that's the comparison. So like asthma and diabetes are a household name. We all know what that is. We all know the signs and the symptoms, and you go to the doctor and you're having these symptoms. Bam, this is what it is. We'll check this and test that, and there's your diagnosis.
Yeah.
The same amount of people suffer endometriosis, and people still don't know what it is. Physicians don't know what it is. They don't know. They get, even in gynecology, I think they get like 15 minutes of endometriosis studying. And I don't even think it's accurate information. But yes, and then to your point of our quote unquote free healthcare, it's never free. I was curious one day. And so I was talking with a friend. She's an advocate who's in the United States. And I had said, if I were to live in the United States and I were to pay for the best of the best, top of the line health insurance, how much is it? How much is it a year? And she said, premium, you're looking at like around $7,500 a year. And I said, okay. So mind you, there's still like out of network doctors that they'd still have to pay for separately, but your hospital stays
but even with our healthcare, we still pay for lots of things separately.
Absolutely. Yes. So $7,500, and that would cover like your top of the line stuff. So like your medications and your doctor visits and ER and walk-in clinics and all of those kind of things, and referrals to specialists and whatnot. So then I found out that 2/3 of your federal deducted taxes off of your T4 go into healthcare. That's what we pay into our healthcare. So if anybody out there is interested, go grab your T4 from last year, find out what your federal deducted taxes are, and remove 2/3. So I'm self-employed, so it works different for me, but I did it with my husband. My husband paid $8,400 into healthcare last year. And I'm like, that's crazy.
Yeah. Yeah, absolutely.
So like, not saying that one way is better than the other, but in saying it, we don't have free healthcare.
No.
We are paying, in some cases, exponentially more than what countries with privatized insurance coverages are paying. So, yeah. And I wanted to make that because I have a lot of, followers that don't live in Canada, and they all say, well, you're free healthcare. It's like, no, yeah. No, it's not free. So I wanted to find something to compare it to.
Oh, absolutely.
And so I was kind of astounded to figure out that, it's our free healthcare costs more than those who pay
than a premium situation.
Yes.
And I mean, you don't see it, so you don't think about it.
And then we still have insurance on top of that.
Yeah. Oh, yeah, because you're still having to pay for your medication.
Your medications, your dentists, your eye doctors, all of that, right? My husband has benefits through work that comes off his paycheck too to pay for. So yeah.
It is crazy.
If you've liked hanging out with the Mom Files, be sure to hit the like button, subscribe to our channel, and leave a comment below.